Welcome back to Yankee Chronicle. I'm Laura James, and I'm joined today by an old friend we've spoken to before and so grateful. Jim Culhane, you are the President and CEO of the VNA.
Yeah, it's great to see you again, Laura.
So glad to have you back. Thank you so much.
You.
So, full disclosure, I am 64, looking into Medicare.
Yeah.
So, hence our conversation today.
Yeah.
So there's some important things to know about Medicare, right?
There are. We're coming upon an important season in the realm of Medicare, which is the open enrollment season, which is beginning on October 15th through December 7th.
It's coming up?
It is coming up quickly. That virtually everybody who is approaching 65 or older than 65 is about to be inundated. And I do mean inundated with texts, emails, letters, with material from a variety of insurance companies looking to sign you up to their Medicare Advantage product. And Medicare Advantage is the Medicare program that allows you to purchase, in essence, commercial insurance under the Medicare name, which is which is different than traditional Medicare.
Okay, so let's slow that down for a minute because I think that's a really important point. We've all been inundated, right? But there is a difference between what the insurance companies are trying to sell you.
Right.
Not saying they're good or bad.
Right.
But then also what Medicare will provide.
Absolutely.
And Medicare provides a couple different levels. So can you help us understand for those?
Yeah, that's a great question. So there's traditional Medicare, which is the Medicare that's been in existence for over 50 years now. Which is a very broad and flexible insurance that we've all been paying into that allows you to take advantage of health care in really any place. It's transportable.
Free.
And it's free. Medicare Part A is free. That's correct, which is the primary Medicare that most people obtain when they turn age 65. Some people also pursue a secondary insurance and Medicare Part B, which covers some additional items. The secondary insurance will cover items that Medicare approves but doesn't pay for. So a lot of people will choose a package of traditional Medicare and say Medicare Part B and a secondary insurance just to have a well-rounded insurance product, basically.
Okay, so when you say Medicare will, in the Part B, will approve but not pay for, help us understand what that means.
So a lot of people will pursue Medicare secondary insurance. There's a lot of companies that do that. Blue Cross Blue Shield, Anthem Blue Cross Blue Shield, United Healthcare, Harvard Pilgrim, AARP. And what they do is they cover out-of-pocket costs that Medicare will approve a service but not necessarily pay the entire bill for. So for instance, if you are in a facility and Medicare will cover 80%, the secondary insurance will cover the additional 20%. So your out-of-pocket for certain services would be nothing.
Let me ask you a question. If you choose to not go through the secondary level, can you get those services through Medicare itself?
You can. So you can get services covered, but you may have an out-of-pocket associated with it.
Gotcha. So you're paying it to Medicare then as opposed to the private insurer.
That's correct. Yep. So traditional Medicare, which is the insurance that we've all been paying into, is a very comprehensive insurance that approves a lot. Doesn't pay 100% for everything, and that's why some people pursue a secondary insurance to cover what Medicare approves, but doesn't necessarily cover the bill in full for.
Now, Jim, how do you sort through it? If you decide not to get the additional services, we'll call it, from Medicare, how do I know who to go for?
It's complicated. And Medicare Advantage, which is really the commercial market's entry into providing services to Medicare beneficiaries, and what that basically is that Medicare will pay an insurance, such as Anthem Blue Cross Blue Shield, to manage a person's Medicare benefits for them, basically. So the Medicare Advantage is your Medicare benefits, but being managed by a commercial insurance. So there's pros and cons. And while we don't favor one versus the other, there are perks to certain products. And we always say, understand based upon your needs as an individual, what insurance product is best for you. And we say that because everybody has unique needs. Some people are healthy, some people are not. Some people have chronic diseases, some people are not. Some people have financial security while others do not. So understanding what a traditional Medicare offers, as well as what a Medicare Advantage product offers, and make a decision based upon your needs.
Is so important. But two very important things that I want to talk about first. Okay, so how can I find out? You had mentioned there's a connection.
There is. So there's a variety of ways people can better understand what products out there are best for them. From a Medicare Advantage standpoint, Certainly, you can do your own research. You can go online. Every program
Right.
has a list of what is and what isn't covered, and you can get into the details about that. You can work through an insurance broker. There's a lot of insurance brokers that some people take advantage of. In our area, we can also take advantage of ServiceLink, which is the county-wide services that are available.
You can see that on the bottom of the screen as well.
Yes,
yeah,
it will
there we
provide
go.
that information. ServiceLink has a service where they are willing and able to sit down with individuals to walk through the different options and try to create a plan and help you choose a plan that's best for you based on your needs.
And Jim, we try to stay in the positives, but tell me about United Healthcare.
Yeah, I'm glad you brought that up, Laura. So one of the reasons why we're promoting and trying to provide education on Medicare Advantage products, because not all Medicare Advantage products are the same. Some are good, some are okay, some are less than good. The issue that we have here is that United Healthcare doesn't have a contract with Lake Sunapee VNA to provide home health care services in the area.
Oh dear.
The primary concern is that United Healthcare doesn't pay what it costs us to provide services. Not unique to us. Other visiting nurse associations in the state have either canceled their contracts or are in their process of canceling the contract. United Healthcare, even though it made a record $22 billion in profit last year, has a business model where they pay visiting nurse associations below what it costs to provide services.
And we love and know our VNA, and for what you do for our community, that's not a good thing.
It's problematic because what that forces us to do is subsidize United Healthcare, meaning we have to seek additional money such as donations to pay for what we feel United Healthcare should be providing. So the issue is that because of that lack of contract with United Healthcare, again, not just us, not just our VNA, but other organizations as well, that individuals have a hard time and or may not be able to find certain services. Coming back to my original point, which is understand what you're purchasing when you look at Medicare Advantage products.
ServiceLink. It sounds like a good connection to help sort through it.
And if home care services, a visiting nurse association that provides home care, hospice services are important to you, find an insurance that provides those coverage for those services because you may very well need it.
May I say because it's important to us. We're all, I mean, what you do in our community is just, it goes without saying. We're going to wrap it up, but we have to get our shots, yes? I know you're going to be talking more about that.
Thank you for bringing that up as well. I would be remiss if I didn't say from a public service announcement standpoint that it is flu season. It is COVID-19 as continues to be a problem for us. So we always recommend that people obtain their flu shot. You can obtain your flu shots fairly easily these days by way of doctor's offices or in your local pharmacy. COVID-19 has not gone away. It continues to cause problems.
It's a big summer.
And I'm sad to say it continues to impact some of the people and the people who can least afford to be sick, unfortunately. So obtain your COVID-19 vaccine.
COVID-19 flu shot and speak to your doctor about the recommendations.
Absolutely.
That being said, do we shake hands still? I don't know the protocol.
Absolutely, we do.
Thank you so much, Jim Culhane.
Thanks, Laura. I appreciate it. Good seeing you.
Thank you.
Sorry.